Hello, everybody. My name is Frank Stichter with Strategic Health Plan Consulting. I've been a traditional broker for about 30 years, and I saw the light after that and became an independent advisor consultant and actually compete against insurance companies. But the CAA, the Consolidated Appropriations Act, it's kind of been flying under the radar with a lot of employers. And understandably so. It hasn't gotten a lot of press, and there's a lot of aspects to it, but one of which is near and dear to my heart, and it's called, in effect, disclosure and transparency. So there's lots and lots. I mean, there's more revenue flowing out there from insurance companies and other vendors, PBMs and other vendors, more than you could possibly imagine. So the CAA, much like its retirement counterpart, that a law that was passed years ago, required disclosure and transparency from investment advisors, companies, and whatnot. So it's very similar to that in that, excuse me, all brokers, consultants, all service providers of any kind are to disclose both direct and indirect compensation or revenue sources and the amounts of revenue, and describe the various services that they perform. And just like its retirement counterpart, what it allows for, because there's so much under the table and undisclosed revenue, which I'll show you some of those sources in a minute, but it allows a plan sponsor, who in turn is a plan fiduciary, to negotiate or at least understand, or perhaps not agree with, but understand all the revenue that brokers and consultants receive from insurance companies and other service providers. So it allows them, since they are plan fiduciaries, they're purchasing insurance with other people's money, namely contributions out of employees' paychecks, but it allows them to act as a responsible plan fiduciary in determining what's reasonable compensation for the services that are performed. Or, I mean, I've sat across from the president and CEO of a PBM just on rebates alone and asking me, how much do I and do I want to receive, the insurance agency want to receive from that PBM? So the sources are various. They're typically commissions. If a broker or consultant is selling an insurance product, they're generally receiving a commission. Not always the case, but it could be for medical, dental, vision, life insurance, supplemental programs, all kinds of sources of commissions. They might also be charging a fee. Could be a per employee per month, could be monthly fee, an annual fee. The big one, though, that a lot of people are unaware of are what we refer to in our business as overrides. So as a broker or an insurance agency builds a book of business with you're going to hear BUCA probably a lot today, Blue Cross, United, Cigna, Aetna, those are the big ones. But as a broker builds a book of business, an incentive to sell more of that BUCA business or to retain the clients on their books, those insurance companies provide commission overrides. And I used one example. I won't name the insurance company, but if you had, let's just, for example, had $1 million of commissions coming in from an insurance company, which quite frankly is not very much for a big agency, especially a national one or a regional one. If you retained or renewed 90% of your business with them, they paid you a 40% commission override. Now, keep that in mind. If you had $1 million book and you retain 90% of it with that, you renew it, they're going to give you a $400,000 bonus. I mean, what broker is going to disrupt that revenue source?
This is kind of where we're sitting. We as employers have got to take charge of this. We've got to take responsibility for this, and we're the ones that are going to get penalized. And we're going to talk a little bit more about what those penalties are, because if you're a CEO, a CFO, chief operating officer, chief human resource officer, among others, you better sit up straight and start listening to this stuff.
Subject, but I've always wondered, why something hasn't occurred previously, because as a plan fiduciary, you are using other people's money to purchase this health insurance, but you don't know anything about the PPO discounts because that's proprietary. You don't know anything about what providers are charging. And so, but you're using other people's money to buy this insurance and you have no clue what you're paying for. And so I'm kind of surprised that, some youngster who's living in their parents' basement, who's paying, out of their paycheck for this insurance, saying, what's my employer doing here? I don't even know what I'm getting and what we're buying and how much it costs and whatnot. So it's time has come, and it's really good for employers, obviously, but it's good for all this to get on the table.
At least one of you mentioned that we may see at some point television ads from attorneys who are putting together class action suits against employers because they have not properly administrated or provided the fiduciary for these ERISA funds that we're talking about. And relative to the 401k, these dollar amounts are much more significant, much more. It's two different worlds.
Well, and the important thing is as it relates to CAA, right? Because employers should have a lot of concerns about their pharmacy spend. And as Frank said, it really is a black box, particularly in the PBM industry. And so this particular set of regulations, I would say, is maybe the first step, not the last step, in terms of driving transparency in the PBM space and in the carrier space. It is much needed because there is a lot of opacity there. And as was stated, the onus is on the employer to collect the information from their PBM, from their carrier, that they then need to turn around and submit and file with the federal government vis-a-vis the CMS website. There's a lot of elements that are specifically targeted towards the PBM industry. I will say one thing, which is from our perspective unfortunate, because we believe in unadulterated transparency, no redactions, nothing to hide. There was another set of regulations that were promulgated in around the Transparency and Coverage Act. And with that, there was mention earlier, I think, about machine readable files. So there's 3 files that were supposed to be submitted. And my understanding is, not USRSCare, but others in the industry sued the government to remove that requirement. And so that requirement has actually been put on hold. Yeah. So those machine readable files are no longer required to be submitted. And we're all waiting to see if and when that will come back. There still are 6 other files that need to be submitted by the end of the year. We can touch on that in just a little bit, but those machine readable files, which were critically important event from our perspective, that are put on hold, one of the things that would have become transparent with those machine readable files is spread pricing. That's the practice where the PBM will pay the pharmacy one price and then charge the client an upcharged price, a higher price. That was part of those machine readable files, and again, that's been put on hold. So it'll be interesting to see what happens there.
What type of reporting is going to be required by the PBM, the broker, and possibly others? Can you give us any sense of what kind of reporting you would anticipate?
Yeah, they have listed the reports, the top 50 most frequent brand drugs, the top 50 most costly drugs, top 50 drugs by spending increase, the RX totals, and then we get to the rebates. So that's going to be interesting. As Frank mentioned, sometimes there's sharing and sometimes there's retention of those rebates by the PBM or sharing of those rebates. So now the top 25 RX rebates and the rebates by therapeutic class, and then they're going to increase that number every preceding year. So I think once, and I'm anticipating they'll start to disclose a lot of this information gathered like they did with Medicare Part D. And that way you can see if your plan is coming up short, if the average rebate for a specific drug was $2,000 or $4,000 and you're receiving $1,000, now you know that you're not getting all of it, right?
It sounds like all the smoke and mirrors is going to get suddenly blown away.
I think we like I said, I think this is the first volley. Those that I've heard in other sessions that were part and parcel of authoring recognized that they did as much as they could with this opening salvo, and that we should all expect there's more to come.
I want to bring Robin in. So we've heard reporting more than once, Robin, and as a data analytics leading provider out there, I'm curious from your standpoint, what are you seeing as a result of the CAA?
Thanks, Bill, and thanks, everyone. I think what we see is that there's really 4 key areas, and that is giving access to the provider negotiated rates and quality. As Renzo mentioned, it establishes reporting requirements for prescriptions that requires the plan sponsors to report prescription drug information to the Department of Labor, HSS, and Treasury. And those reporting requirements are pretty standard, which is good news from our perspective. But what you're saying, Bill, is so true. It's data, 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 and reporting.
Extremely helpful, Robin, and I guess as a former CFO, Chief Operating Officer, I mean I've got to hit the pause button here. It's this is an awful lot to unpack and be prepared for. I'm curious what the benefits are of an employer retaining a consultant who is paid exclusively by the employer and does not accept any third-party commissions or overrides. I would think that suddenly a lot of these challenges of the CAA might go away in that situation. And but I'm going to pack on top of that question, Frank, another one, which is getting back to the title of this session, which is how to avoid your employees filing class action lawsuits against planned fiduciaries. And I'm curious what you might see or advice that you would have as a consultant to employers to maybe help them think through that. And you're on mute too. That's all right.
Thank you. Sorry about that. I think if an employer, to me, has to ask a question, and it's what's the value that a broker or consultant brings? Is it in the advice that they give, or is it in the products that they sell? So it's so misaligned right now because a broker is being paid by an insurance company to sell their product to an employer. It's like being a car salesman. I want to sell this Cadillac to this employer because the GM or Cadillac or Chevy, doesn't matter, they're going to pay me to sell this. So from a compensation perspective, it's very much misaligned. And as I said before, to have a disgruntled employee who comes after their employer because maybe they feel they're paying too much out of their paycheck, or they don't like the plan they have, or their deductible's too high. I'm a little surprised that plan fiduciaries haven't been challenged because of the lack of transparency in the insurance and provider world.
I'm smiling a little bit because I'm trying to get my arms around this idea. PBM and fiduciary. I don't think I've ever heard those two terms weaved together. So,
right.
So help us understand what that all means.
Yes. Well, this is near and dear to our hearts here at US RxCare. We came out of the health plan space, managing pharmacy risk for health plans. Plans with upwards of 2 million lives, Medicare, Medicaid, and commercial populations. When you're managing risk in a health plan, managing your own risk, there are no conflicts of interest, right? Everything is aligned. The formulary is in line with the guidelines, in line with the sourcing. Everything is aligned. Unfortunately, that's not the case in the PBM industry, which was one of the motivations that led us to get further into this space and to move specifically into the employer self-funded marketplace, because we saw a gap there. In terms of fiduciary is a term that is defined by ERISA. It also is pertinent in the financial services industry, as you know, but with respect to ERISA, there were three primary tenets. Number one is no conflicts of interest. Number two is only looking out for the best interest of the plan and the plan enrollees. And number three is all utilization and all financial information is in full view. So back to transparency. So those are the three tenets